Swinomish tribe is located in the south end of the Fidalgo Island. We have a population of about close to 1,100 people in our community. Swinomish is a service tribe. We want to and are expected to provide the best services possible to our people. We have always had a vision and understood what a healthy community would look like. But the services that the government promised us, in my opinion, they never followed through with their promises.
Right around this site here where we're sitting, the tribe used to have a dental trailer.
An IHS, Indian Health Service provided trailer, and we would have itinerant dentists that would come through and provide services there. The elders tell stories of the dentist wearing a butcher apron and coming out crying and with gauze, and that was really their dental experience.
I remember as a kid going into the trailer we had, you could hear what's going on in the next room.
Our dental care was basically, if you had a toothache or a cavity, you would go in there and they would just pull your tooth out. And so it was a very, I want to say, barbaric way of doing dental care. It created a lot of historical trauma within our tribal members.
When I was a little girl, I was always just deathly afraid of going to a dentist. We used to be talked to real harshly when we went there. I fought it my whole time until 2 or 3 nights of bad toothaches, not sleeping, not eating.
And a lot of kids didn't go to the dentist because, that one-time experience pushed them away from their oral health care.
So I've been in public health for my entire career, and coming into Indian country, the health disparities are pretty significant. There's 3 times the decay rate as well as periodontal disease. And I feel like our dental delivery system has really failed Indian country. Folks were paying a lot of money to get dentists right out of school into underserved areas. And those dentists, they weren't really taking ownership or they weren't invested. And so they would be there for about 3 years, just long enough to build up trust and relationships, and then they would move on. And it was in the late 90s that the tribe really wanted to change all of that.
Thank God our leadership had a vision.
So we were the 27th tribe in the country to go self-governance. And as part of the evolution of self-governance at the tribe, I was asked a key question as the administrator, which was, where is the area of greatest disparity for our community? And that was an easy answer. Oral health was our area of greatest disparity. It was clear that there were severe deficiencies in what IHS was able to provide to us. So we took the initial step to contract for field health services, which included the dental program. So post self-governance, the tribe was willing to commit its own resources.
In the 90s, we built a new clinic, and that clinic improved our dental care tremendously.
And I remember sitting at the construction site with the chairman at the time, Robert Joe Sr., and he turned to me and he said, "This is a really good day, John. Well, this means that my grandchildren and great-grandchildren will not end up like me." And he reached up and he pulled out a full set of dentures. He was happy that now the people in the community were going to get better because they deserved better.
We just had the one dentist. You would wait months to be seen for simple things.
We found that dentists were doing 50% of procedures that could be done competently by a mid-level provider and do it at half the cost.
And that's when we were looking at, is there another provider type? What's working in other places? Chairman Cladoosby had traveled up to Alaska and was hearing all the buzz about DHATs, about dental therapists. And he wanted to see what that was all about. And seeing it in action, he was like, I want that here.
So that leads us up to a decision that we, in fact, should pursue dental health aide therapists as a mid-level provider at Swinomish. Problem was the legislative framework for doing so. The Indian Healthcare Improvement Act had been passed, and that's how the Alaskan CHAP program with DHATs was initiated. But it only authorized that in Alaska at the time. And when the Affordable Care Act passed, the Indian Healthcare Improvement Act was embedded in the ACA. The problem was that the IHCIA required state approval. We were recruiting existing Alaskan-trained dental health aide therapists to come down to the lower 48. And we had sent 2 of our own tribal members to be trained in the program in Alaska.
I came in for regular cleaning, and Dr. Daly said, do you want to become our first dental therapist? And I would say within the first 20 seconds of watching him interact with the patient, I knew that's what I wanted to do. Asia and I moved to Alaska to attend the Alaska Dental Therapy Education Program. I felt like that was my calling. This was my time to give back to my community members.
Dental health aide therapists, dental therapists, can increase the access to care. I actually call them primary oral health providers.
A lot of people compare us to nurse practitioners. Our scope of practice is around 100 of the 500 procedures a dentist can do. So we do the most simple, most needed procedures, fillings, simple extractions, cleanings, exams, a lot of preventative service. You've got beautiful teeth.
And so it allows me to get into other procedures that you don't normally see in community health, such as implants and crown and bridge and complex root canals.
Being a dental therapist and working in our community has opened so many doors to connect. So we have a program focused on elders. We have a program focused on preschool and daycare. Do you want to take a flavor? They instantly jump up and freak out and come and give me a hug. And they all fight over who's gonna get to brush their teeth first. So I set up all the toothbrushes and I'll do mouth rinse, toothpaste, and floss.
I go to 3 rooms. I see the babies, the waddlers, and toddlers.
Your turn. Good job, Johanna.
And we floss all their teeth, we brush all their teeth. I always ask them what's the rule to mouth rinse. They always shout, no swallowing, no swallowing, good job. Okay, this time we're gonna count to 20.
I would say that most folks, most Native folks, they have never had a Native provider. And so it's inspirational to watch our DHATs be mentors to some of our young folks.
And we've had quite a few tribal high school students that even come here and shadow us and work with us for the summer. And they're interested in hygiene, they're interested in dental therapy, some want to become a dentist.
The Alaska model's great and the school's great, and the problem, I guess, for our tribal members was having to go away for 2 years. And so we felt if we could bring it closer to home, that we could get more tribal members interested in the dental careers.
We decided to go down this path and bring on dental therapists. It was not a recognized profession within the state of Washington. So there wasn't a way to get licensed, and Swinomish elected to create their own licensing board.
We have a problem, this is the solution, and we're going to move forward with it.
And the position of the State Dental Association was not in favor of dental health aide therapists. So we were unsuccessful in year 1. Year 3 was a defining moment in the whole process. The chairman said, well, we've tried to do it their way, and we can't wait any longer because our people's needs are so great. The chairman said, we're going to do it our way now. We're going to go self-governance, and we're going to figure out a way to make it happen.
And in 2015, we established a dental licensing board.
So it actually exceeds the Washington state regulations for licenses because we need the clinical skill set for sure, but we're looking for another piece.
For the first time ever in any tribe in the country, we made a requirement that every oral provider would have to show and exhibit cultural competency. The Swinomish tribe has partnered with the Skagit Valley College to develop the first 2-year training program for dental health aid therapy in the lower 48. And the tribe is very proud of what it's been able to do, but also feels like it has an obligation to expand the program and expand service at other tribes.
A lot of other tribes have been taking advantage of our education program, and they're coming from other states.
So each tribe will have to chart its own path, but those that have gone self-governance have the knowledge and the understanding that they, in fact, can do a better job of meeting their own community needs than relying on outside entities.
Dental therapy and tribal sovereignty really intersected in a powerful way. I'm excited for more dental therapists to be going out to their own communities and being able to do what me and Asia do because it's really, really special.
Adding dental therapy was just a real huge win for Swinomish. It changed our dental and oral health care. It changed the way people looked at dentists, starting with our kids, and they're getting positive experiences.
Becoming a dental therapist has probably been one of the best decisions I've made in my life. I just know that what we're doing is really impactful and it's really powerful.
It's amazing for us to be able to build this new connection with this younger generation, in a sense reversing that historical trauma that our grandma, that our great-grandma went through.
I know a lot of my children didn't really go to the dentist if they didn't have to, but more of us are getting more comfortable going there because how kind and caring they are. All my grandchildren, Kaylana's age, they're more confident of themselves. What a huge difference. I'm glad we do what we do to try to educate all our families, and just love that they love their smiles.
I think that's really cool to know that we started something within our community and it opened eyes to a lot of people. It's a priority for our community. I think that's a beautiful change for our community for the better.
Way oh hey